Welcome to the American Security Council Protecting Our Freedoms podcast. The mission of the American Security Council is to educate and engage American citizens on national security matters, economic security matters, and the need for moral leadership in the United States of America. Please enjoy the podcast.
Welcome to our podcast. I'm your host, Roy Vatrabek, Senior Research Analyst for the American Security Council Foundation. And today we are going to be discussing socialized medicine. And with me to do that is Dr. Joseph P. Crawford.
Hello.
Welcome to our podcast.
Thanks so much. A pleasure to see you, and thanks for having me.
You're welcome. And Dr. Crawford is also a Board of Director member here at the American Security Council Foundation. Thank you for your service to our foundation. We appreciate that.
It's one of the great honors of my life to be able to give something back.
Sir. And could you tell us a little bit about yourself and your background?
Surely. I'm a board-certified urologist and have been in Vero Beach and Sebastian since 1985. I was raised in the Midwest and then in Baltimore. Graduated from Ohio State. Undergraduate, then University of Maryland for medical school, and then the Medical College of Virginia for a residency and a fellowship. Moved to Vero and was fortunate enough to live in the golden age of medicine, and had been in private practice. I've been in group practice, and I've seen the evolution of what's come to pass for medical care in this country, and obviously have very strong feelings about it because I live it every day.
That is certainly an impressive past, and you are certainly qualified to talk to this subject, so could you expand a little on socialized medicine? Certainly.
Well, I think that we have actually models in front of us for socialized medicine. The idea of being able to treat the vast herd of the population has been utilized in Europe, as well as in Great Britain and in Canada. And quite frankly, it has been a disappointment. Certainly there is care that's provided, and the idea is that you won't have to worry about it because it's something that's provided as a quote-unquote right. Well, when something is provided like that, that means that there are usually few exceptions to care that needs to be provided. And unfortunately, we're not all the same. And all cancers are not the same. All heart attacks, all strokes are not the same. And therefore, different requirements are needed to be able to adequately treat patients. One of the things that when I was training, we knew that the highest honor that you could have and the highest responsibility you could have was to be given the care of another human being, to put their needs above your own, to do the absolute best you could to take care of them, or find the person that you could have take care of them that would provide care better than yourself. And right now with socialized medicine, there's really no choice. You're assigned a primary care physician or a gatekeeper. That gatekeeper is employed by an insurance company or a hospital. And right now, many of the hospitals and the hospital systems are actually insurance companies under the guise of hospitals. They're owned by corporations that want to collect a premium ahead of time under covered lives, whether it's an HMO product, an accountable care product. Those individuals receive money, the corporations receive money at the beginning of the month for your care. Usually for a Medicare patient, that's $700 or $800. If they can keep their costs less than that, obviously they make money. Their goal is to keep that those dollars under $300 to $400. That's why you see the first time when you or a loved one are in the hospital, the first question is they're trying to find out is when can you go home? Because the hospital is a cost center for them. They have to have it because they're a quote-unquote healthcare provider. But it's where they have to ship their patients that they absolutely have to put in the hospital. So consequently, what they're looking forward to do is getting covered lives. And in accountable care, you want to have 5,000 accountable lives or more. And if their margin is $500 times 5,000 per month times 12 months, you get into the multi-millions of dollars what you're talking about. So consequently, you don't have a real choice. You are assigned a primary care physician. If you don't you don't like that primary care physician, that primary care provider, they give you another one, will have many of the same goals, which is to limit care. They'll provide care, but they're on a time clock. Many offices in socialized medicine will have a clock that in the background. You hear a ding, where you get 5 to 7 minutes with the provider. Well, for me, there's no way that you're really going to be able to take care of a difficult patient, maybe who has diabetes, obesity, cancer, heart disease, many issues, problems with medications. There's no way you're going to be able to do that. So consequently, you have limited choices, and there's limited care. Their goal in socialized medicine is to limit care, to do quote-unquote preventive care. But when you hear the words preventive care, in the true sense of the word, it's a great goal. Try to avoid a problem rather than have to treat it. But essentially, they're not going to try to keep you from overeating, controlling your diabetes, your hypertension, keeping your doctor's appointments, being compliant on your medicines. So consequently, they realize that's almost a near impossible task unless you're really motivated. So consequently, those individuals at 5 to 7 minutes, they're out the door, and you haven't addressed many of the issues that are there. You don't have the choice of physicians. In terms of that, many times there will be someone who is an expert in your problem. Well, if they're not on that panel, then don't have the ability to go see them, or your quote unquote insurance doesn't cover it. That means it's out of pocket, it's a part of the deductible or copay. Any way you look at it, you're paying for it. So consequently, they're taking money for your care, but you're not getting the care, you're having to buy it yourself. So consequently, for me, the fact that you don't really have good choices is a huge problem, because I think that is one of the best parts of the patient-physician relationship, is understanding the needs of the patient, understanding their social situation, their concerns, and being able to read maybe the unspoken body language or concern that they have, without the idea that you have to drive through a certain number of patients to get them through the system.
So what I hear you saying is that basically with socialized medicine, the doctors are not able to spend the time they need to with the patient to really understand the problem.
Well, we've had examples in our own community with very well-known physicians within the last 4 months that were either fired or let go from socialized systems, HMOs, accountable care systems, because they spent too much time with their patients. They didn't do enough. That's reprehensible, because quite frankly, that's why we're there, is to answer those concerns. We've had individuals that were let go because they referred the patient to a specialty center that was specialized in those problems. In Florida, it's an acute problem, because we're dealing with many times with an older population. In my practice, 65 to 70% are Medicare age or older. I was going to ask that. And so consequently, many of those individuals need specialty care. Being in the profession as long as I have, I build up relationships across the world. So if someone comes to me with a specific problem, there's a good chance I'll know who's the best to treat him, or I'll know people who will be able to tell me and guide that patient and sit there and answer that. So quite frankly, not only is it the time, but remember that those institutions and corporations and the government, quite frankly, are invested in limiting the amount of dollars that they spend. That means limiting the choices that you have and your options. So consequently, I think in terms of choice and freedom and the free market, it isn't about that cost. Quite frankly, you could get free care, but it was terrible care. You wouldn't want to go there. You'd say, I'll spend the extra money to make sure I get better. The second problem with socialized medicine is the lack of innovation. The idea that most of us went into medicine is because it was a high calling to serve our fellow man, but it was a challenge. We had to take risk. We had to take financial risk going in getting training. We had to take risks setting up our practice and taking the loans and doing all the things that it takes. And then, quite frankly, we had the risk, the emotional, professional risk, when somebody trusts us with their life or their health care. And so consequently, when they take away those qualities that made us appreciate the profession so much, then all of a sudden you become just a cog in the wheel. And that's what the corporations want. That's what the government wants you to be a cog in the wheel. Don't want you to raise a fuss, want you to go back, go to work every day, not say a word, do your thing, and when they can find somebody who can do your job cheaper, you're going to be replaced. And the local scene is replete with people that have gone to work for one of the local institutions, hospitals, or insurance companies that have been let go for a variety of reasons. And then all of a sudden, somebody like University of Florida snaps them up and is happy to have them. Not because they're not bad physicians, not because they can't get along, but because they didn't fit the mold of being able to have a ring in their nose and a collar around their neck and follow a cookbook. Cookbook medicines works great when you've got healthy patients. But everybody's different. We're all different. We all have a little different history. Maybe we've got different genetics. Certainly we may respond to different disease states differently. And we've got to be able to have the freedom to do that. So I think there's a problem with being able to be innovative, and you have to follow that cookbook. The physicians.
I understand if I can interrupt you. I understand a little bit what you're saying, because my husband has to go to the VA for treatment, and that's basically one size fits all. If you ask me, they treat most of their patients, let's say for instance PTSD, one particular drug that they believe works, and they don't really want to deviate from it.
Absolutely, and I'm one of the VA choice physicians, so I see people outside from the VA. But they realize that I've got a good track record and I've got loyal patients, and so consequently, I'm blessed to be able to take care of the veterans.
I believe that's a more recent program.
I'm not going to get political, but the VA I've got a lot of experience with. I started being a VA doctor in 1983, so I kind of get the drift. And the last administration prior to the current one was the one that put their foot down and said, you know what? You need to be able to treat these people right. They put their life on the line. There are problems with Agent Orange. We're still finding more problems with Agent Orange, 40 years after Vietnam. So consequently, for me, I think that when you don't have that options to individualize care, I think it's a huge problem. And I think that if you're a healthy patient, hey, the VA or socialized medicine can work right. If it's a wellness check and we'll check your blood pressure and make sure your meds are okay and your labs look okay, fine. We'll see you in 6 months or a year. That's fine. But when you're sick and you need to have options and you need to spend time, not only is the resources limited, but look at the way they're taken care of. The physicians in the community are discouraged from going to the hospital. If you are a physician that's bought by a hospital, and you have a private practice and family practice in internal medicine, these hospitals are discouraging you from going to the hospital to take care of your patients, even though you know those patients the best, even though those patients trust you the most, even though they've seen you in good times and bad times, and maybe over the course of many years. And the reason why is they want to put you in with a hospitalist, and that is going to be a person that's going to be data-driven, and as I said, that data is the first question in his mind is when can they be discharged? And quite frankly, there's a difference between, in my profession, a 40-year-old with a kidney stone and an 80-year-old with a kidney stone. So consequently for me, when you are a hospitalist, and I'm not besmirching them, I'm not getting down on them, but first of all, they have an allegiance not to the patient. Their allegiance is to their employer, because they know if they don't take care of those dollars, they'll be gone. They'll be replaced. Second of all, in terms of the care of those patients, when you're discouraged from being there, there's a level of trust that isn't there with those patients, because they know that they haven't ever seen this hospital before. They're never going to see him again. And those hospitalists are very aware of the data, what your labs or your chest x-ray looks like, or maybe what your vital signs are. And they know the data. They don't know the patient. They don't know maybe what the strains and the struggles you have had at home, or your living situation. They don't know how you're going to fit back into what is called in medicine the activities of daily living. How you eat, how you shop, how you dress yourself, all the things that need to happen for you to live a normal life. And quite frankly, with socialized medicine and segregating those individuals, sometimes not for the best of reasons, with an ulterior agenda, for me, that leads to a problem with patient care. Furthermore, lack of innovation. Where did all the virus vaccines come from? Free market capitalistic societies. They didn't come from socialized medicine. Not Pfizer, not Johnson & Johnson, not Moderna. Where did the polio vaccines come from? The United States. Where did CT, MRI, CAT scan? Where did PET scan come from? It came because people took risk, were innovative, could think out of the box and be creative. And when you're penalized for being creative and you're told that you have to follow a certain dogma, I think that stifles creativity. So consequently, when you ask the last great drugs that were independently devised or developed in socialized countries, or with socialized medicine, it's going to be few and far between. And so consequently for us, we all want the same thing. We want future generations to live better than we did. Right. That's how we don't have smallpox. That's how come we don't have kids in braces and iron lungs with polio, because we could think out of the box. So for me, not only is it incumbent upon us to take the best care of patients, but the best care of patients come through innovation, dedication, and inspiration. And I can tell you that if you would go to any of the employed facilities and ask those employed doctors, are they inspired? I would say few and far between, if they're being honest, will say they're inspired. Me? I'm inspired. Why am I inspired? Because we've got great things coming in right now. We're understanding the genetics of cancer. We're going to be able to sit there and say without a biopsy, yep, you've got a cancer. This is what it kind of is. This is where you're going to be your options. So you can be thinking ahead, and we can maybe either try to prevent or rechannel where that cancer is and reorganize your genetic code in the future. That's exciting stuff. I mean, I think that the great joy that we have of seeing patients is that we get to know them. They trust us. We feel an obligation because of that trust. When somebody trusts you with their life or their health care, it isn't like saying you've gone to a restaurant, and I'm not getting down on restaurants or anybody else, but it's a different obligation. Finally, I'd say that the issue is trust. And I think that you have to have the idea that whoever's taking care of you has your best interest at heart, that you're their number one priority, that they're available for you, that while they're taking care of you, you're the primary obligation. And so consequently, when you're switching hospitalists, if you're in the hospital every 2 or 3 days, or if you've got a primary care that, is going to sit there and maybe see you once a year, if that, and is just going to triage you to different specialists, not really get involved with your ongoing care. For me, I think that involves a lack of trust on the patient. I mean, who am I going to see today? Are they just going to scurry me out the door and call in my prescriptions, or are they really going to take a look at me? When you're young and healthy and bulletproof, hey, you don't care. You want to have the medicines.
It's true.
But as you get older and you start having more issues, you want somebody to know they've got your back. Mm-hmm. So consequently, I think that in terms of trust, it's a huge problem if you aren't available. Secondly, you've got a question about their allegiance. Who are they really caring for? Are they caring for the patient, or are they the arm of the insurance company to make sure the insurance company maintains their profits? And I use the broad term insurance company of all the mandated care that maybe comes in form in terms of the government, mm-hmm. Universal health care, quote unquote, HMO, ACO, all those acronyms that stand for care that is provided, by an entity that doesn't have the primary responsibility of your health, of your good outcome. Their obligation is to provide care or health care, not good health care, and not certainly outcome-driven health care.
I know healthcare is a major concern for all Americans. Cost-wise, would you say we should get away from the Medicaid, Medicare programs?
Well, I think actually the idea initially with Medicare was actually a good one. But remember, in 1966, when it was devised for people 65 years and older. Mm. And the reason why it was because the average white male lived to 66 years of age. Mm. They didn't fathom the fact that we were going to have CAT scans, that we were going to have genetic testing, that we were going to be able to look at the DNA sequence, that we were going to be able to do some of the marvelous things that we can do now in a variety of fields. So consequently, they really didn't keep up with that adequately to fund it. Certainly, there is some basic coverage that we all feel that everyone should have. Mm-hmm. But I think that when you try to sit there and cover everyone with the same coverage, and when you mandate what's going to be done, you do a great disservice to the individual patient. And that's not even talking about what's going to happen if half of South America comes across the southern border. Mm. So consequently, I think there's some huge questions to answer. I think it can be done in a way that takes advantage of the great quality that separates the United States, as well as many parts of the Western world, democratic capitalism. Okay, let's see if you come up with a great idea, better mousetrap. Guess what? You can benefit from it, but it's got to be survive in the marketplace. Doesn't matter if I wear the nicest tie, I look good, I comb my hair, I got a nice coat on, and I'm fairly well spoken. If I can't deliver at the end of the day, if I can't do the job that I'm supposed to do and help you to your healthcare goals, I'm going to be out of business. And I think that is an innovation that has to come about. Put people at risk. Doctors before were at risk. I came from a program where we started 18 interns and finished 6 chiefs. That means if you finished, the guy on the left of you and the right with you was gone. Mm-hmm. So there's some pressure there, but that pressure is good. Mm-hmm. That pressure causes you to ask and question yourself. Am I doing the right thing for this patient? What if this doesn't work out? What's plan B? What's plan C? What's plan D? What's plan E? All those things are what, in my mind, make American medicine unique and outstanding. And that's why when I trained and finished, we were the best healthcare system in the world. Oh, you don't treat every patient, and there are people that go without care. That's not true. There's a difference between not having insurance and not having care. I can think of no time in my 40 years as being a doctor when their patient came to the emergency room, whether it was in Maryland or Sebastian or Vero Beach or Richmond, Virginia, that we ever refused patient care. Never. You know what happened? Too. Those patients got taken care of, and at the end of the day, we figured out, well, okay, we lost on this one, we're going to make it up on that one. And you know what? Those hospitals did well. Those doctors did well. More importantly, those patients trusted those physicians and those institutions to be there when they needed them, have an allegiance to the patient's best interest in healthcare, and being responsible. In other words, it didn't matter if it was 5 o'clock, didn't matter if it was 10 o'clock. If that patient was there, you were responsible and you were going to be there. And so consequently, the idea, okay, we're going to do this shift work, and the hospitals are going to be there and they're going to be gone, and she's going to be gone tomorrow, and then we're going to have a new person and they've got to get a hold of you. Well, he said he was going to do this and they didn't get that done. It's a Chinese fire drill. Let alone the patient who leaves the hospital and then has to go back to their family doctor or their internist who doesn't know exactly what was gone or how it went on, or if there were any problems. Because a lot of times the data doesn't get transferred because the computer systems don't talk to each other. And lo and behold, and God forbid that one of the hospitals gets on the phone and calls Dr. Jones or Dr. Swayze or Dr. Thomas or Dr. Gray and tell them, hey, your patient's coming home and we were concerned about this. Can you follow up on that? That never happens.
I noticed that a lot with the VA. Not to pick on the VA, but I noticed that a lot because I've been through it with him.
Well,
no communication there, no handoff.
And I think that's a huge, huge problem. Because many times, all of a sudden, I'll be going through VA records and I'll say, they didn't say anything about this lung nodule. Mm-hmm. Wait a minute. Guy's been a smoker. He's got a lung nodule. We've got to follow up on that. So consequently, I think for me, socialized medicine, just like socialism, it's a failed experiment. It sounds good in theory, but in practice, it hasn't borne out the fruits, and it isn't what you would want your father or your mother or your husband to have, especially if they're ill, especially if they have special needs. So for me, I think that capitalism and a democratic capitalistic society that can divide and devise good healthcare and can reward those who come up with the best solutions is going to be our best alternative for the future.
And when you say solutions, are we talking more like competition as far as insurance companies are concerned?
Sure.
Would drive down prices?
Why isn't insurance portable? Why? Because they want to have a fiefdom. They want to have that control. It's about control and power. And one of the things Trump did was when he put $100 billion on the table and said to Moderna and Pfizer and Johnson & Johnson, hey boys, there's the money. Let's see who wants it.
Competition.
Correct.
You yourself said that in school. There was only 6 people left. It was competition.
Competition provides you with a resolve and a preparation, instills the desire to be prepared and a resolve to follow through and to set priorities. And quite frankly, it is one of the best things about capitalism. From Adam Smith coming from Wealth of Nations to Benjamin Graham. So consequently, I'm a believer of capitalism, and hopefully I'll be a patriot all my life.
I think you will.
Thank you.
Thank you.
Appreciate it.
Any other thoughts before we close?
No, I just would like to thank the American Security Council Foundation. I think they do a great job. These are very challenging times. And I'd ask anyone who hears this podcast and shares the idea that America is a great place, that we weren't built on false ideals or slavery, and that they're proud of their country, to consider supporting the American Security Foundation in our quest to keep America great.
Thank you. You're doing my job for me.
Well, thank you.
I appreciate you coming on the Protecting Our Freedoms podcast today, taking your time out today.
Well, it's my pleasure, honor. Hopefully we'll get to do it again sometime.
That sounds great. And as the doctor said, yes, you can support us by going on our website at www.ascf.us and donate to our cause there. You can also view this podcast on YouTube by typing in ascf.us. And we would appreciate your support because we recently have been deleted from Facebook. So anything you can share with family and friends, we would truly appreciate. Again, thank you.
You're very welcome. Thanks so much.
Until next time, stay safe.